Good evening, everybody. Let me welcome you on behalf of the Bombay Management Association this evening. This is a special Friday Fundamentals program of the Bombay Management Association, which is part of our wellness series. Today, this series has two very distinguished medical practitioners, both of them who have perhaps reached the zen and the pinnacle of their service to the community with the profession that they belong to in two very important areas of specialization. Dr. Viswanathan, who is a specialist in cardiology, and Dr. Roy Patankar, who is a specialist in what they call treatment of stomach disorders in the simplest of language. It's indeed a privilege that both of them have readily consented to be part of this learning session that BMA has organized for all of you today. As always, Professor Mani, welcoming you warmly to this event. We follow the normal protocols. We request each one of the doctors first to finish their presentation, share their key highlights, after which you are welcome to pass on your questions through the chat box. Each of them will be able to spend a maximum about an hour with us because it's a working day and they'll get back to their medical practice. But continuing with our Friday fundamentals tradition, they kindly consented to be here with us. Let me welcome all of you once again and have the unique privilege first to introduce to you Dr. Viswanathan. Dr. M. Viswanathan is a gold medalist from the Mumbai University, and he completed his MD in cardiology in the year 1982. Over the last almost 4 decades, he has been one of the forerunners in interventional cardiac care. A doctor of very high repute, a doctor who is known for his extreme high sense of integrity and dedication and commitment to patient cure. He is a consultant to Breach Candy, Jaslok, SR Mehta, and several other leading hospitals in the city of Mumbai. I also warmly welcome Dr. Roy Patankar. I will introduce Dr. Roy to you a little later when his session is about to commence. And on that note, I once again welcome Dr. M. Viswanathan with a deep sense of gratitude and request him to please begin the session. Over to you, Doctor.
Good evening, ladies and gentlemen. It's my pleasure to be in this group to address you all on the very touchy subject of cardiac management. Just a moment.
Right, we are fine with the slide. Yeah, we just need to get it into the slideshow. Perfect.
It's already in the slideshow, Dr. Professor Mani.
Now it's perfect, sir. Go ahead, please.
Yeah, okay. Zen and the art of cardiac maintenance is the topic of discussion today. Why did I choose Zen as a beginning word in this discussion? The world around us has turned topsy-turvy, stress is everywhere, and we are unable to relax and have a placid life. That possibly has led to an increase in the cardiac diseases in the last 3 decades. There has been an increase in the diseases in those people who are either to exempt from such diseases like young individuals, like young females, females before the menopause. And so we require some special art of cardiac maintenance, which is what we are going to discuss today. Before we go on to the topic, let me make certain disclosures. Disclosures, not financial disclosures, but disclosures about the content of this talk. Contents are not personal opinions or viewpoints. These are all scientific statements honed by 40 years of medical practice in Mumbai. All statements are from authentic cardiology source, that is American College of Cardiology. All statements are made in conformity with the ACC guidelines. No controversial statements have been endorsed. These statements, let me warn you about this, these statements may run counter to what you have been fed by social media forwards. This is very essential because the source is as important as the content. The content might be interesting in many places, but the source might be dubious. So here the source is the reputed American College of Cardiology which sets the gold standard as far as the cardiac treatment is concerned, cardiac investigation is concerned, and they set the guidelines for all procedures to be performed by treating cardiologists. And why are we discussing this now? Cardiac diseases have reached epidemic proportions. Younger people in the prime of life are affected. This comes without a warning. In one third of the cases, death is the first presentation of cardiac disease. Despite adequate treatment, the lifespan of the person is curtailed, and many times the known risk factors are not readily manifest. It even affects those without a family history of heart diseases, and now females, even before menopause, are being affected. When we were studying cardiology in the 80s, when I was a lecturer in medical college, we used to have a joke among cardiologists. Women don't get heart diseases, they only give it. That was the refrain at that point of time. But now, more and more women are being affected. Possibly they are into the lifestyle of the men who are thrown into the stresses of modern living, and possibly maintaining a career and family possibly is affecting them very adversely, and they are being affected with cardiac diseases even before the menopause. What are the antecedents of heart disease? High blood pressure, diabetes, tobacco usage, high lipids in blood, stressful lifestyle, family history of heart diseases. You might ask me a question. Suppose a person has none of these, is he immune from heart diseases? No, it is not like that. It only means that statistically, when a person has one or more of these diseases, he stands a greater chance of getting a heart disease. It doesn't mean that if the person does not have these diseases, he will not get heart disease. Only the chances are lower. Now, you must have heard about the word coronary artery disease. What exactly is this? Coronary artery disease is the narrowing of the coronary arteries that supply blood to the and oxygen to the heart, and that is responsible for heart attack, for cardiac failure, cardiac rhythm abnormalities, and that is the most common type of heart disease. Now, statistics are not very well maintained in our country, so we have to follow whatever statistics which have been culled from the American system. And there in USA, it kills about 3,70,000 people annually. If that is the statistics in the USA, with our population, which is almost 4 to 5 times more than the US population, you can just imagine what could be the numbers. So, what are the signs? There could be shortness of breath, there could be unexplained fatigue, chest pain, nausea, vomiting, and in the heart attack, these are the symptoms. A special mention about fatigue. A person who has been able to walk 5 kilometers every day, suddenly, if he finds that he is not able to walk even 1 kilometer, that is a cause for concern. That's one something which show a red flag and make you go to the cardiologist and get yourself examined. And we are going to discuss this, how to prevent it, how to treat it later in the talk. Now, why does cardiac disease take place in the common condition, the younger individuals? That's because of the condition called metabolic syndrome. Our metabolism has changed in the possibly last 40 years, and that has led to increase in the incidence of heart diseases, increase in the incidence of stroke, increase in type 2 diabetes. What are the characteristics of metabolic syndrome? Abdominal obesity is not general obesity, abdominal obesity, waist being significantly increased in size, abdominal girth being significantly increased in size, high triglyceride. All everybody knows about cholesterol, but hardly anybody knows about triglyceride. Whenever you eat food, the body absorbs the sugar, converts into form of triglycerides, and sends it to the liver. And in the liver, it is metabolized and harmonized, converted in the appropriate mode of energy, and sent to the respective organs. If this metabolism is abnormal, high levels of triglycerides are thrown into the bloodstream, and that produces flowing fat into the blood in the form of triglycerides. These triglycerides also can produce the same ill effects as bad cholesterol. The other one is low HDL, high density lipoprotein or good cholesterol. If the HDL cholesterol is low, there is increased incidence of coronary artery disease and stroke. With 1% increase in HDL cholesterol, you have a 2% reduction in the incidence of heart disease. So higher the good cholesterol, lesser the incidence of heart disease. And the metabolic syndrome also consists of high fasting blood glucose and high blood pressure. If any two of these are present or any three of these are present, metabolic syndrome is definitely confirmed. And this is found in most of the people above the age of 60, and in people, 1 in 3 individuals in the US population has got metabolic syndrome. And now we are catching on with the increased availability of caloric intake in the form of greater availability of food. Our caloric intake has gone up, but our lifestyle has crashed, and that has led to increased incidence of metabolic syndrome among young individuals in India. And that leads to obesity. This obesity leads to cardiac diseases, cerebral diseases, and type 2 diabetes. You must have heard that more and more people are getting type 2 diabetes, and that is one of the pointers to the increasing metabolic syndrome in our society. So this is what I've summarized. 1 in 3 adults have it. Almost diabetics, all diabetics have it, and those with abdominal obesity have metabolic syndrome. Metabolic syndrome is a forerunner of cardiac diseases. And let me also tell you one point, that we are not going to talk too much about the glamorous facets of cardiology like angioplasty and bypass surgery in great details, because in our country, preventing cardiac diseases will yield more rewards than treating one angioplasty. One angioplasty cost will treat about 20 or prevent about 20 people getting cardiac diseases. So we should focus more on preventing cardiac diseases. One of the major reasons for type 2 diabetes, or one of the major reasons for cardiac disease, is type 2 diabetes. This is a condition that occurs when your body cannot properly process sugar into energy. Whatever you eat goes into the body, and the body has to utilize this glucose in the appropriate form of energy. It has to be pushed into the muscles for the muscles to function well. It has to be pushed into the brain. Incidentally, brain is one of the most prolific usages of glucose. 25% of all the calories which are consumed goes to the function of brain even while you are sleeping. The body fails to use insulin correctly, or the pancreas fails to make enough insulin. The first one is responsible for type 2 diabetes. If the production of insulin in the body is less, it's called type 1 diabetes. Type 2 diabetes, there is resistance to the function of insulin. There is adequate insulin available, but the person is not able to utilize it properly. What are the symptoms? Most of the time, there may not be any symptom. That's why it is called as a silent killer. There could be extreme thirst. You're feeling hungry even after eating food. Frequent urination. If you have a cut in the finger or toe that doesn't heal well, the sensation in the legs are significantly reduced, and there could be blurred vision. What are the organs affected by diabetes? Nervous system, that you can have dementia. Dementia means inability to recognize things, and the functions, the cerebral functions get reduced. There could be stroke, that is, there could be paralysis. The eyes could lose their strength, and vision might be impaired. The coronary arteries can get blocked, and you can have a heart attack or a chest pain on exertion. Kidneys undergo what is called a diabetic nephropathy. The kidneys progressively reduce their function, and you find that the kidneys efficiency goes down. A stage is reached when it is called chronic renal failure, when the person requires a dialysis. Blood vessels can get blocked, and they develop what is called peripheral arterial diseases, where the person while walking gets pain in legs and is able forced to stop. And in the feet and skin, there could be gangrenous changes. The skin can turn black, and the infection can persist for an abnormally long period of time. So why is it that type 2 diabetes dangerous? High blood pressure can lead to stroke, can lead increase the risk of chance of developing heart disease, and there could be reduced vision, there could be impairment of the function of the muscles, and there could be gangrenous changes in the limbs. All of them make type 2 diabetes an important disease to be tackled. It is not just blood sugar, it is much more than that. It affects all the organs, just as the rasgulla is soaked in the sugar, or organs are soaked in excess sugar, and that can damage our organs, and that too irreversibly. Diabetes increases the risk of heart disease 2 times more in men and 4 times more in women. Diabetes affects 1 out of 10 people in the US. So you can just imagine that India is being slowly called the diabetic capital of the world. The numbers are so many that they are saying that there will be almost one-fourth of the people will be diabetic by 2050. Heart disease is the leading cause of disease due to diabetes. This leads to heart attack, stroke, and peripheral arterial disease. What is the ABC of treating diabetes? The ABC HbA1c, that is the average of the last 3 months blood sugar values, should be kept under control. Blood pressure should be kept under control. Cholesterol C should be adequately kept under control. The one other thing that you remember is you should take medicine if prescribed, and see to it that you maintain a proper lifestyle. Sugar is something which has crept into our food or into our lifestyle surreptitiously. We were thinking that sugar was to be only added in coffee or tea, and possibly in our food cooking. But you find that sugar has surreptitiously entered in all our food items. Even the breakfast cereals contain inordinate amount of sugar, and that can produce a significant damage to the pancreas and the diabetic milieu, and the person can develop type 2 diabetes even when he is eating the so-called diabetic or so-called safe food in the form of cereals for breakfast. And that has to be remembered when you factor the amount of food being taken, the amount of sugar being taken in your food. And there are multiple ways in which sugar can come into our diet. It could be in the form of honey, it could be lactose, it could be mud, high fructose corn syrup. This is the most dangerous thing which has happened. High fructose corn syrup has been added to most of the preserved foods. You do not even know that this sugar is being added. You see the labeling of most of the cereals which are being sold from the supermarket shelf, you'll find that high fructose corn syrup is added. And any of these syrups could be added: agave syrup, beet sugar, cane juice crystals, cane syrup, or plain dextrose, evaporated cane juice, or glucose. Any of these will be contained. And most important, if you want to avoid sugar, and if you start drinking like something like a diet cola, that is more harmful. Diet cola contains aspartame, which is a chemical substance which has been known to produce changes in the brain, and it can produce symptoms like a multiple sclerosis. And then comes another disease which is afflicting the commonly the Indians. This is obesity. You find that more and more people are obese in India, which was not the situation 30 years back. What is the difference between the poor in India and the poor in the Western countries? And the poor in the Western countries are very obese, whereas the poor in the Eastern countries like India used to be very thin. Now it is changing with more caloric intake being available. More and more people are becoming obese, and that leads to heart disease, high blood pressure, high cholesterol, diabetes, heart failure, heart attack, and stroke. The waist size can signal trouble for any person. 35 inches or more in women, 40 inches or more in men is abdominal obesity. Just losing 5% of a body weight can lower your heart risk significantly. Body mass index is calculated a ratio of the body weight divided by the square of the surface area of the body. So, what is the method to correct this? Exercise more, eat fewer calories, get enough sleep, limit alcohol. These are all common methods to treat most of the what is called the metabolic disease that we are confronting nowadays. In management parlance, it has been said that once you know the numbers in a problem, you can solve it. Any problem which can be reduced to numbers can be tackled. So if you know the numbers in cardiac disease, you'll be able to correct them. Blood pressure should be less than 130 by 80. Mind you, you might be fed so many things. Age plus 100 is your right blood pressure and all that. These are all not valid statements now. 130 by 80 is the blood pressure to be maintained for all people of all ages. Blood sugar fasting should be less than 110. Post meal should be less than 140. HbA1c, which I told you, that is average of 3 months of blood sugar, it should be less than 6 if you are non-diabetic. If you are diabetic, it should be less than 7. Total cholesterol should be less than 200 milligram per deciliter. LDL cholesterol should be 100 milligram per deciliter. And if a person has had a myocardial infarction or a heart attack, it should be less than 75. Now I come to a situation where they are advising cholesterol should be less than 55 if a person has had a cardiac problem. Alcohol, not more, less than 3 packs a week, not more than 2 packs in one session. Cigarettes, zero. Chewed tobacco, zero. Eggs, less than 3 per week. Red meat, better avoided. Waist measurement, less than 96 centimeter. BMI, less than 25. These are the numbers you should remember and try to achieve that. This is what I mentioned. You should treat the heart disease before it starts. Heart disease will affect 1 in 2 adults in the US. Most of the time, healthy habits can prevent it. Eat heart healthy, move more, that is, exercise more, maintain a healthy weight, avoid tobacco, manage cholesterol, manage blood pressure, control diabetes. These are the mantra of controlling and treating heart diseases. And there is something called familial hypercholesterolemia. This is a condition which you inherited from your parents, and you can do only limited amount to treat it. It's an inherited condition with dangerously high cholesterol levels. Early cardiac events, including sudden death and brain strokes, are known in families. Very high LDL cholesterol levels, even more than 160 milligram per deciliter in kids, 190 milligram per deciliter in adults. Nodules under the skin or tendons called xanthelasmas or tendon xanthomas. White rings around the cornea, this is called arcus senilis. When you look at a person in his eye, you'll find a white ring in the center of the eye. White rings around the cornea are indicative of changes in the coronary and other arteries. Cholesterol doesn't come under control even with a conventional treatment. If a patient has got familial hyperlipidemia, there is 50% chance that the child will have it. Very early screening for cholesterol in these families is mandatory. There are certain families where the males do not live beyond the age of 40. Possibly these are the families with familial hyperlipidemia, which is producing cardiac diseases. This is a much maligned kind of topic, statins. People with, I don't know what is the reason, this has been found, the statins have been maligned very badly, but the statins have been responsible for reducing the cardiac diseases in a significant way. It's the most useful class of drugs to reduce heart disease, reduces chance of heart disease by more than 45%. This was confirmed more than 3 decades ago by a study called Forest study, where simvastatin, the first statin to be used for suggesting the reduction in cardiac disease, was studied. A lot of misinformation is spread by less knowledgeable or with perverted motivation. There is a, the people keep on taking that there is an increase in diabetes. Yes, there is 1% chance of those prone to diabetes, and the risk of diabetes is offset by prevention of heart disease. Even though there is incidence of type 2 diabetes in people taking statin in 1%, that too only in those people who got a tendency to develop diabetes, if there is a family history or if the person is obese. Occasional patients of muscle pain, this can be prevented by coenzyme Q10. The drugs which are commonly available are atorvastatin, rosuvastatin, pitavastatin, simvastatin. Previously, another statin called lovastatin was available. It is not being used now. How do you maintain cholesterol, and how do you reduce the incidence of heart disease? The get the decision made by the cardiac clinician. What are the things that you should look for, and whether you should discuss with your physician what are the risks of getting a heart disease. There is a algorithm produced, and there is an app available, ASCVD app, atherosclerotic coronary vascular disease app. If you download it, you put all your details, you'll get a estimate of the 10-year chance of developing cardiac diseases. Depending on that, the treatment is decided. Most of the time in the Western countries, they're using it more commonly, but here also it is catching on. So it depends upon the age, race, sex, family history, smoking. high cholesterol, high blood pressure, chronic kidney disease, metabolic syndrome, and diabetes. The reason why we mention race is Indians are more prone to heart diseases as compared to the other people. And you find that Indians are 6 times more prone to cardiac diseases as compared to the Western population. Even if Indians were migrate to other countries, their incidence of heart disease keeps on increasing. So, what is a heart attack? Heart attack happens when the heart's blood supply is suddenly cut off. Most commonly, it is chest pain, shortness of breath, discomfort, or tingling in the arms. The way to handle it is immediately call for a now 108 is available, and don't delay. Every minute of delay means damage to the cardiac muscle. What is cardiac arrest and what is heart attack? Every cardiac arrest is not due to heart attack. There could be a sudden stoppage of the cardiac function called the cardiac arrest when the pulse is felt, there is nothing available. This could be because of ventricular fibrillation where the heart muscle doesn't pump enough blood into the peripheral circulation. Whereas a heart attack, the blood supply has been cut off, the person is having chest pain, but there is still a pulse. The etiologies are different. But if the person has got a cardiac arrest, immediately if somebody starts a cardiopulmonary resuscitation, there are chances that will be person will revive. If you use the something automatic external defibrillator, which you'll find in most of the places where there are congregation, like in the airports, there is a great chance the person can be revived. Your mind should be kept calm and the body should be kept active. That is the idea of controlling the heart disease. How do you reduce the stress? By breathing exercises, meditation, progressive muscle relaxation, soothing music and yoga. And exercise could be dancing, brisk walking, gardening, household chores such as vacuuming and everything can increase your physical fitness. There are wearable technologies available in our country, but whether to use it is an individual choice. There are technology available to find out what is the number of steps that you take, what is the blood pressure, what is the average heart rate, and during sleep, what is the duration of sleep. And there are technologies available to monitor your sleep also. But whether to use it or not is an individual response. And those people above the age of 60 should be more careful about their lifestyle. You should know your blood pressure, keep it a very well controlled, be active every day, don't let getting older stop you. Connect with others, this is very important. Emotional connect with many people is going to improve your longevity. Bring a list of all your medication reviewed at every health visit. This is important. You choose a doctor who is willing to spend time with you and not hurriedly give you a prescription. After a setback, if there is a heart attack or a stroke, physical therapy or cardiac rehab can help you get moving again. Ask for help if you are depressed, lonely, or having trouble with daily tasks. The reason why we are emphasizing that if the person is depressed, there is increased chance of a cardiac heart attack and increased chance of sudden death. Set your care goals and share them with your loved ones. You discuss with your family members what are your difficulties and possibly set the goals and correct them with the help of your family members. So what is said is to protect your heart, eat more of vegetables, whole grains, and nuts. So Mediterranean diet has been touted about in a big way. It consists of fish, olive oil, and wine, and fresh fruits. This less on dairy, meats, and sweets. Vegetarian diet consists of no meat at all, and soy products are used in place of vegetarian paneer. And there are other things available called dietarian approach to stop hypertension dash diet limits salt to less than 1,000 grams a day. Lean meat is used, poultry or fish, fruits and vegetables are consumed in a big way. This is something which has come in a big way in the recent past. People were not aware of this condition called sleep apnea. Previously, we used to think that snoring is a healthy thing to be done. Snoring means the person is sleeping well. No, it is not that. Sleep apnea is a common disorder in which the breathing stops briefly during sleep. Pauses last for 10 to 20 seconds and occur as many as 30 times an hour. What are the signs? Usually, morning headaches, dry mouth, and loud snoring, which usually the spouse complains of, and gasp for breath, as if he's panting for breath, is something. What happens is the oxygen saturation in the blood during sleep goes down and the person stops breathing. And the person wakes up frequently, is not conscious about it. So the frequent stoppage of breathing and waking up makes the person feel tired when he gets up in the morning. How to treat it? Lose weight. Generally, obese patients have got this. How to identify this? There is something called a sleep study where we monitor the sleep duration, we monitor your breathing during sleep, and come to the conclusion what should be the method of treatment.
I think we have lost Dr. Viswanathan. Maybe what we'll do is we will request Dr. Roy to begin his presentation. And hopefully Dr. Viswanathan, who had some network issue, will be back with us, and then we can continue. Allow me 2 minutes, Dr. Roy, to have the honor of introducing you. Here
Sure.
is yet another very, very well-known, famous doctor. He has graduated from the GS8 Medical College, having completed both his MBBS and MD from there with flying colors. Subsequently, he's also done his FRCS from UK way back in the year 1993, and subsequently is one of the most famous gastrointestinal surgeons, doing a lot of work in the field of laparoscopy, digestive endoscopy, and so on. The founder director of the very famous Zen Hospital in Chembur. It's our honor to have you here with us, Dr. Roy. Over to you to begin your presentation.
Thank you, Mani. Can you see my slides and hear my audio?
Perfect. Please go ahead.
Great. I'm not sure Mani is a friend of yours. Just before the weekend, he stops your alcohol, he stops your wine, stops your sugar. He's going to make me talk to you all about indigestion, and it's going to really spoil your weekend. I think in today's day and age, patients, doctors, everyone is drowning in information, but starving for knowledge and wisdom. And I hope that the next 1 hour with answering your questions will allow you to alleviate some of your anxiety and focus on what is relevant. You know, one thing I've realized looking at all these management gurus like Mani and many successful doctors in Chembur is you need three things to be successful. You need gray hair like Mani, you need a big paunch like me, and you need very big piles. If you have gray hair like Mani, people think you're a wise man and they trust your judgment. If you have a big paunch like me, the patient feels you're a rich man and you want to fleece them. And if you have very large piles, you have a permanent look of pain on your face and the patient feels you're concerned for him. So thank you, Mani, for the excellent introduction. I want to run you through some very common problems we see in the digestive area, which is what I work in. I'm basically a surgical gastroenterologist. So we'll start off by what is most common. After a long weekend of rich food, all the things that Dr. Viswanathan said you shouldn't do, but you and I are still going to do it because we are the way we are. So this is heartburn. In Hindi, we call it amlapitta, which basically means burning behind the chest, or sour liquid coming in the mouth, or food coming in the mouth. And all of us once in a while do get this common problem. When this becomes a recurrent or a severe problem, we call it gastroesophageal reflux, because as a specialist, I have to give it a big name. How can I charge you a big consulting fee if I just call it heartburn? You also know the diagnosis. So what basically happens to you is because God has designed the food pipe or the esophagus not to handle acid. The acid is supposed to remain in the stomach. And there's nothing wrong with producing acid. Acid is required. Acid is your protection against infection, against bacteria that may be in the food. But when this acid comes into the food pipe, it causes these burns. What actually, imagine a situation where you drop scalding hot water on your forearm and you get a blister. Similar things happen to your food pipe and you get these kind of blisters in the food pipe giving you pain. As I said, heartburn is not uncommon, but when you have difficulty in swallowing, if you have a weight loss with that, or a black colored stool, or a family history of gastric cancer, please see a gastroenterologist. When we say black colored stool, it means there is some bleeding within the intestinal tract. What happens is the hemoglobin is converted to acid hematin by hydrochloric acid, which is in the stomach. And more we believe in family history has an important role for this. What does tend to happen, this is an endoscopic picture. What is endoscopy? We insert a flexible tube through the mouth into the food pipe to look at the inside of the food pipe. Now, what you are seeing is a precancerous condition called Barrett's esophagus. And what happens is when you get acid repeatedly coming in the chest, you get these kind of precancerous changes happening. This is what is called by acid burns. This is what happens when people, I don't know why they do it, but sometimes they consume acid or Harpic as a suicidal attempt. And similar kind of ulcers you see as in reflux. And we have many options to treat this, but the important thing is please do not self-medicate. Remember to look for the danger signs. Difficulty in swallowing, the so-called acidity may be what you're seeing in this picture. And this picture is of a cancer of the food pipe or a cancer in the esophagus. This patient had some months of burning behind the chest, but was losing weight, had difficulty in swallowing solids, and this was actually a cancer of the food pipe which was there. The treatment has become much simpler now. This is a picture that I took in 1995 when I began practice in Chembur after having returned from England. And on the right-hand side is what we do now. Most of these cancer surgeries we do either by endoscopy or by laparoscopy. You know, when I trained in KM in the 90s and 80s, I was told big surgeons make big incisions. My bosses would cut from the wrist bone down and make a big cut on the tummy. Nowadays, the bigger the surgeon you are, the smaller the incision you make. This is the era of minimally invasive surgery. I'm not going to show you too many gory things. We'll now move from the food pipe to the stomach and the liver. One common thing we see these days is fatty liver. This is a picture of the liver taken by a laparoscope. The normal liver is maroon red brownish. When it starts getting this kind of yellowish hue, it is because there is excessive fat deposition in the liver called fatty liver. And we now believe that in the long term, people with fatty liver may develop cirrhosis of liver or even liver cancer. So this is something that we need to remember. Alcohol obviously is the commonest cause. To quote William Shakespeare, increaseth the desire, but taketh away the performance. And this is what a full-blown cirrhosis looks like. Cirrhosis, ladies and gentlemen, is an irreversible condition of the liver, primarily because of alcohol, but also could be because of fatty liver and obviously hepatitis B and hepatitis C viruses. If you have liver disease or you start getting a person who has just indigestion, starts getting swelling of the feet or dark colored urine or weight loss or black colored stool or has a family history of liver disease, your antennae must be up. These are what I teach my students are red color signs and warrant investigation. We do know that people with liver disease sometimes will vomit blood. So why do you get vomiting of blood in liver disease? You can see the picture on the left is large blood vessels in the food pipe, which are called varices, and we treat them by putting bands on these varices to take care of the bleeding. So these are various pictures. I'm not going to spoil your weekend by showing you these pictures, but these are some of the things that we'll see. We can see abscesses of pictures in the liver. So a lot of water is flown down the Thames. And even for liver cancer, you can see what I have done here is I have removed almost 40% of this patient's liver for a liver cancer. The liver is, ladies and gentlemen, the only organ which can regenerate. So I can promise you that in 2 years, the liver will grow back to the normal size and shape. I remove a part of your kidney, a part of your lung, a part of your heart, it's never going to grow back. But if I remove part of your liver, the liver will grow back in 2 to 3 years. It will have full. This is the liver tumor, which is 10 by 12 centimeters. And these patients have an almost normal lifespan ahead of them. We have many, many options of treating this. I'm going to keep my presentation short because I know there are a lot of questions in people's mind. But I think we ought to discuss about hepatitis B and hepatitis C. When we talk of jaundice, ladies and gentlemen, jaundice is a symptom. It is not a disease. There are many causes of jaundice. And the common causes of jaundice are some infections you get in infected food and water. And the commonest we say is linked to monsoons, the hepatitis A. But these are usually self-limiting jaundices and patients rarely will die of this. We then get jaundice because of diseases like malaria or dengue fever, where there is a breakdown of RBCs and jaundice is a symptom of the underlying infection. And then we have hepatitis B and C. Extremely important to make sure that you and your family members are vaccinated for the hepatitis B vaccine. The cost is hardly 100 rupees. And whether you are 5-year-old or you are 75-year-old, please make sure that you've completed your course of hepatitis B vaccine. Everybody should be taking this. Extremely important. There is also a hepatitis A vaccine available, but it has a very short-term efficacy, but Hep B is lifelong cover. We then move to the next part of the small intestine called the duodenum. And these are the areas where you get ulcers. Now, we were always told when I was a medical student that ulcers are because of hurry, worry, and curry. That is spicy food, a bad lifestyle, or constantly worrying about something. There's an interesting story about causation of ulcers. There was a young Australian scientist called Barry Marshall. He felt that ulcers are because of a bacteria or a bacterial infection, and he was laughed out by the other colleagues because everybody said, you know, ulcers are because of acid. It's because of irregular lifestyle. It's because of spicy food. So like all Australians, Barry Marshall was a very persistent guy. He first got his own endoscopy done to confirm that he had no ulcer. Then he swallowed a large amount of this bacteria called H. pylori, and 2 months later had another endoscopy done, and lo and behold, there was an ulcer in the stomach. So this in the early 80s was the first time that we started believing that ulcers also needed antibiotics. And in fact, this young man, Barry Marshall, got the Nobel Prize for Medicine for this discovery. This is what an ulcer looks like. The symptoms you will get are indigestion, burning, pain in the upper part of the stomach, which is relieved by passing food. Pain sometimes goes to the back. And when you do an endoscopy, as I mentioned, you see these yellow things in both pictures. These are what ulcers of the duodenum look like. And this is extremely important to diagnose to prevent. There could be complications of ulcers. The picture on the left is an ulcer that has burst into the abdomen, causing pus in the abdomen. And this is a surgical emergency, it can kill you. The picture on the right is an ulcer that is bleeding. This patient came vomiting blood to Zen. He was passing blood in the stool. He had a long history of acidity. And more importantly, he was giving history of taking painkillers. Common drugs like Combiflam, Brufen, Vovaran can worsen ulcers or acidity if you have it. So please be careful in taking these drugs. Cancer of the stomach is called captain of the men's of death. Delayed diagnosis, basically because patients don't have much symptoms. The symptoms of early gastric cancer are the same as you would have in any indigestion. Just a nausea, just a mild weight loss, loss of appetite. So if you are above 40 years of age and you have a weight loss, or you have black colored stool, or you have persistent drop in appetite, please consult a doctor and consider having an endoscopy done. This is very, very important that we should all remember. Coming on to another simple thing, what is a hernia? We often get talked about hernias. Hernias are usually caused by obesity, when your weight goes up a lot because of coughing, lifting, or straining, and you always see this kind of lumps appearing in the abdomen. In women, hernias are commonest at the navel, and in the adults, hernias are common in the groin. Why are we so bothered about hernias? Because rarely a hernia is as a hole in the muscle through which the intestine comes out. Normally, the intestine comes out and goes back in. But if the intestine remains and gets stuck outside, the blood supply to the intestine will go. And this is what is called a strangulated hernia, and cause gangrene and loss of blood supply, and is a obvious source of problem to the patient. So any hernias, generally, if the patient is fit, we would advise a surgery. And most of the times, these surgeries, as you can see me doing here, are always laparoscopic. You never stitch a hernia anymore. You put what is called a mesh, and it can be a polypropylene mesh, a polyester mesh, or what have you. So remember, at home, when ladies in the house, your trouser tears at the knee, they never stitch the cloth because the cloth will get frayed. Similarly, if you try and stitch a hernia, as you become older and your muscles get weaker, the hernia will come back. So what do the smart ladies at the home do? They put a patch of a different material from inside. And the surgeon does exactly that. Laparoscopically, we put a mesh or a net from inside, and that prevents the hernia from recurring in the future. So these are various laparoscopic tricks. The beauty of this is the patient can go home in 24 hours. There are no stitches to be taken, and the recovery, usually patient is back to work in 3 or 4 days. So these are the common sites of hernias. As I mentioned to you, in males, hernias are in the groin. In females, commonest are the navel. And these are various pictures of hernias that you can see in women. And this is the epigastric hernia. These are some very large hernias. And this is a hernia that somebody got because of breaking of stitches of his previous surgery. And this is called incisional hernia. And this is a much more complex problem that we need to do. But all of these, most of these can be managed laparoscopically. And this is the age of keyhole surgery or minimal access surgery. The last 5 minutes of my talk is about common problems like piles, fissure, and fistula. That is the other end of the body. This is what we are going to discuss in the next 5 minutes. So what is the difference between piles, fissure, and fistula? We often use these terms quite liberally. So this is a picture of fistula. When you have pus discharging from boils in the bottom, it is called a fistula. A fissure is merely a wound at the bottom end, and patients who have fissures basically get pain when they're passing stool, and they get bleeding when they're passing stool. What is the cause of fissures? Hard stool. So generally, for all these the one common factor that you will find is constipation and straining at stool. If you can avoid these, you can generally avoid most of your problems. हमको बवासीर हो गया. What are piles or bawasir? See, remember the words fistula, for example, in Hindi is called bagender. Piles are called bawasir. So piles are nothing but blood vessels that get enlarged. And the common causes of these piles is constipation and straining at stool. Another common cause is pregnancy because the gravid uterus is pressing on this. And the symptoms of piles are bleeding and a swelling or pain at the bottom end. This is very, very important. So who can get piles? Anyone can get piles, but obviously people in middle or late age are more common to get. And this is what piles look like. You get a swelling at the bottom end. You often have pain when you're passing stool, and you may or may not get bleeding. But beware of the common signs. Important to get yourself checked. Don't just say this is piles and take some homemade remedies. You can go to the doctor of your choice. You can go to an allopath, an Ayurvedic doctor, a homeopathic doctor, but insist that he examines you from below. ये नाड़ी परीक्षा से piles नहीं मालूम पड़ता है. You need to examine from below to confirm what it is, because remember, some of the common symptoms of piles or fissures can also be seen with large intestinal cancer. Like I told you for food pipe and stomach, let me tell you about some danger signs. So if you're a patient who is getting alternate loose motion and constipation, who has a weight loss, who has mucus. What is mucus? Sticky white stuff like you get from the nose when you have a cold. Or you have a family history of large intestinal cancer. You know somebody in the family who's had cancer or has died of a large intestinal cancer. Please be careful. The simple test to do is to get a proctoscopy and get some doctor of your choice to examine you. And please don't go to quacks, or don't go to your neighbor or your friend. The prescription given to your friend may not be the best prescription for you. So don't be the proverbial munnabai. Please see a doctor of your choice. Get yourself diagnosed. And any pathy is good, whether Ayurveda or allopathy or homeopathy, but get diagnosis by a qualified person and then do it. Don't be scared of piles. Most piles never require surgery. In my practice, 99% of patients can be managed with treatment of constipation, local agents, and we can often use simple techniques like injecting or banding the piles. This is a simple way of banding the piles. We have many now options available, and this is nothing quite unusual like open surgery. I will end my talk by telling you what is happening. This is the first world, what is called a Lindbergh's op. The first in the world was called Lindbergh. So this is a operation done by a surgeon sitting in Strasbourg in southern France when the patient was in Lagos in Nigeria. We have broadband, we have many beautiful things happening, and this is where the future will be. I think artificial intelligence, machine learning, a lot of new things are exciting stuff. And I think the COVID pandemic has just accelerated this. But as I said it, you're flooded with information. What you need to aspire for is knowledge and wisdom. And I hope Mani with his initiatives will be able to do much more in this. And I'll leave you with the words of Captain Kirk. I don't know about you, but as a kid, I followed Star Trek a lot. And Jim Kirk saying, well, he said, my God, Jim, we can't live him in the hands of 20th century medicine. Those butchers will use needles and knives and cut open his belly and chest. It's still the dark ages. You have no idea what these barbarians will do. Thank you very much, ladies and gentlemen. I'll be happy to take any questions if Mani may permit me. Thank you.
Sure. Thank you. Thank you very much, Roy. That was a very, very captivating presentation with a great deal of humor, though you were presenting on a topic which, as you rightly said, was a bit scary, and the visuals compounded the same. We had unfortunately lost Dr. Viswanathan's network for a couple of minutes, and therefore, for purposes of continuity and to manage time, we requested Roy to take on. Dr. Viswanathan is obviously back with us here. Doctor, are you able to hear me? I request you to unmute, please.
Yep.
All right. So, sir, would you complete your presentation, or shall we begin taking questions?
Yeah, there are a few things which I would like to show before I go on to the talk.
Okay.
2-3 slides are there which I'd like to show.
Okay.
Can you see my presentation?
Not yet.
Not yet. I'm not finding the. Okay. Can I see now?
Yes.
Okay. A few things which have been mentioned is about the coronary angiography. The selective coronary angiography was an accident. Mason Sohn in 1958 was doing a ventriculogram by introducing a catheter to the left ventricle, and accidentally while withdrawing the catheter and without his knowledge, it had gone into the right coronary artery. And they injected to find a ventriculogram. Instead of ventriculogram, they found a right coronary artery. That's how the angiography started. And subsequently, Mason Sohn produced many catheters which showed the various outline of the coronary angiography. And subsequently, we go on further innovations, further developments. And this is the blockage in the coronary artery. You can see the yellow buildup of the coronary plaque, which is part of cholesterol. And we have introduced a guide wire. On the top of it, there is a balloon. And this is connected to console on the other end. And the balloon is inflated. The fat on the sides of the coronary artery gets plastered to the sides, and the artery is widened. And this widened artery can increase the blood flow through it, and the person's symptom can be improved. And to prevent the coronary artery from narrowing again, we introduce a coil of stainless steel called stent. This is where it is. Sorry. This is the development of coronary artery disease. The fat gets deposited to begin with in the irregular surface in the coronary endothelium, and as time passes, this cholesterol accumulation keep on increasing. You can find this increasing further and further, and you find that there is a significant narrowing. This will prevent the normal flow of blood from taking place, and when you exert yourself, you don't find the uh, blood flow increasing as it should normally. So what we do is we do an angioplasty. We pass a guide wire through it. On the guide wire, we thread a small balloon tip catheter. And when the catheter is increased in size by inflating from outside, the passage is improved. And the next time, after the balloon is removed, we introduce a balloon covered with a stent. And when we inflate the balloon, the stent dilates and you're able to permanently hold it aside like a scaffolding. Actually, the stent acts as a scaffolding to prevent the narrowing of the coronary artery again after balloon dilatation. This stenting has improved the surgery significantly. This is a video showing the coronary artery bypass grafting where you can see the graft being put in place. This is the heart, and the graft is taking the blood from the original source into the area of the coronary artery beyond the blockage. This improves the blood supply and the patient's symptoms significantly reduced. This could be either a vein or an artery taken from the posterior portion of the chest. The vein is usually taken from the leg and grafted into the coronary artery. This is called coronary artery bypass grafting or a bypass graft. And this is what we do in coronary angioplasty. This narrowing is open and we leave a stent, and this stent produces a good flow into the distal coronary artery. And this is a new technology which has come in called TAVR, transcatheter aortic valve replacement. Previously, aortic valve narrowing had to be treated only by an open heart surgery. Now we are able to treat it by introducing a catheter into the femoral artery, into the aorta, and across the narrowed aortic valve, and that aortic valve is replaced by a prosthetic aortic valve introduced to the catheter. There are benefits and risks, but now it is increasing in numbers, and even in Bombay it is being done. The only factor which is preventing the widespread usage is the cost. Cost is about 17 to 24 lakhs, so there is a certain hesitation when utilizing this process. But over a period of time, I think this tower will become less costly and more people will benefit from it. Thank you for giving me the opportunity to speak. And this is a talk which can go on endlessly, but there is a scope for discussing this further, which possibly we can take it up during the chat session. Thank you so much.
Thank you, Dr. Viswanathan. And may I request you to end the presentation slides, and I'll then put across some of the questions that we have both for you and Dr. Roy. All right, so there are lots of questions, so it's going to be, I think, something like a rapid fire as they call it, and as they come in, I'm going to share them with you. One of the first questions which I think comes across as a common question is, what is the importance of diet both in managing the heart and managing the stomach? I think that was one of the key points which both of you covered in your own way. So can we have some responses, please?
Can I take this question?
Yes, please go ahead, sir.
Diet is very important. The change in diet is responsible for many illnesses that we see in the commonly in this era. Our diet has shifted from basically fiber-rich, uh, complex carbohydrates to very purified carbohydrates, very deficient in fiber, and increase in the fat content. And fried substances have also increased. This change has left significant changes in the blood constituents. The cholesterol has gone up, triglyceride has gone up, and at the other end, as Roy has said, constipation has increased. And there is, because of the decrease in the fiber, there could be other changes like there could be polyposis, that is outgrowth of the in the large colon, and these things lead to a lot of inflammatory bowel disorders which are seen commonly in our lifestyle. So I think changing the diet is going to change your lifestyle more positively. But unfortunately, not much importance is being given for diet. And I think it is time for us to recognize that diet is, we like in the ancient time they should say, we become what we eat, because whatever we eat goes into each and every cell. If you eat too much of fat, the too much of fat goes into a cell. If you eat the proper kind of food, you would have a healthy lifestyle.
All right. And there is a specific question here, and that is how serious, Dr. Viswanathan, is MVP? I'm just reading out a question from one of our participants.
MVP stands for mitral valve collapse. This is a condition in which there is an increase in the movement of the mitral valve by closing. Normally, the mitral valve is supposed to close like this in one plane. And when the length of the mitral valve is more, they bend against each other. And this bending produces sudden changes in the architecture as well as function of the mitral valve. And this produces sudden strains on the left ventricle. And that produces the symptoms. Most of the time, this is benign. If this produces only the bending, and there is no separation or leakage of the blood flow from the left ventricle into left auricle, there is hardly any problem. But if the mitral valve is associated with the leakage into the left auricle or left atrium, as we call, this increases the load on the left ventricle, and that produces significant changes in the hemodynamics and the physiology of the left ventricle. That produces palpitation, breathlessness, but many times this is found more often in ladies, and they are associated with only on examinations of mitral valve click. It may not be associated with the mitral regurg. But if there is a leakage, what we call as a mitral regurgitation, that requires treatment. If the person were to undergo some procedure like dental, GI, gynec procedure, the person has to do it under antibiotic cover to prevent infection in the heart. But if the leakage is very significant, then we'll have to repair the mitral valve or even replace it. But that comes much later in stage. But not a significant proportion of people go into surgical treatment. Most of them can be controlled with medical treatment. Only if the mitral regurgitation or the leakage of the mitral valve is very severe that the person would require any surgical treatment.
Okay. Dr. Roy, there are two questions. One is what is the impact of diet on managing stomach disorders? This is something you did touch, but people are asking for a little more information. And a very specific question is generally menopause tends to impact cholesterol, is what many ladies feel. Is this true or false? And would you like to give some advice for this?
So diet has a major role to play both in the upper GI as well as the lower GI problems. For example, heartburn and acidity, the simple thing to do is to cut down on fried, spicy, oily food. Don't lie down after a meal. Have frequent small meals. These are simple things you can do. As far as piles, fissure, fistula, constipation, bloating, gas, the common things we tell patients is to have a high fiber diet. So increase the amounts of veggies you're having: cucumber, carrot, radish, green leafy vegetables, papayas, bananas. Increase all of those. If you have a tendency to forming gas, I usually tell my patients to reduce the amount of milk they consume. They may have curd and buttermilk, but cut down on milk, cut down on cabbage, brinjal, and chanas. Chola, kabuli chana, and the besan, chana dal is something you really want to avoid. Menopause basically is a condition when women have hormonal changes as the periods get over, and it impacts virtually every system of the body, from mood swings to cardiac to weight gain to also they tend to get constipation and bloating as a cause. So these are some of the important things that we need to remember.
All right, I understand that, and that was something very encouraging for all the women in the room to particularly understand. Question for you, Dr. Viswanathan. Is it a good idea to walk post dinner? Question one. And is it better to walk or use the treadmill for walking?
Yeah, the first question first. After dinner, previously it is we thought after dinner walk a mile, but that is not correct. If a person has got a cardiac disease, any walking after food should be avoided, because after food the body requires blood supply for digestion. On the top of it, when you start walking, that imposes a high load on the cardiac system. It is not advisable. And if you walk in after dinner, it stimulates, it might disturb your sleeping pattern. It stimulates production of cortisol and other growth hormones during the exercise, and that may prevent you from going back to sleep. The best time to walk is when your stomach is empty. I would prefer walking early morning if it is not possible, much before your dinner time. That would be my advice. And if a person has got a cardiac problem, never to walk after dinner. And about the treadmill or using walking outside, there is a qualitative difference, may not be quantitative. If the treadmill is on a flat surface, if you are not put the incline on, and if you walk at 4 or 6 kilometers per hour, that's absolutely fine. But the thing is, when you walk outside, there is environment is stimulating, and you possibly might walk more. But it all depends on the individual. But in the treadmill, you don't preferably put the incline on. You might have more exercise, but it's strenuous to the back, and a person might develop severe backache if a person were to put the treadmill inclination on. So you walk whichever is comfortable to you, but if it is raining or if it is not comfortable to walk outside, you might use a treadmill, but use it in moderation. But one bit of caution: anybody over the age of 40 starting an exercise should get himself evaluated by a cardiologist with ECG and including a treadmill test before going on to a treadmill, because a sudden startage of exercise without being evaluated by your physician can be damaging to the heart. There have been instances where people have collapsed on the treadmill because they had some cardiac problem while doing a treadmill. So be careful about that.
All right. Dr. Roy, the question
I
here
just want
is,
to add a sentence, Mani.
please.
Just a sentence I want to add is, please keep an hour's time gap between your dinner and before you lie down. So I'm not saying you do intermittent fasting, but make sure for the last 1 hour before you lie down and go to bed, do not have anything to eat and drink at all. As Dr. Viswanathan mentioned, for various cardiac and GI, having a heavy meal and immediately lying down is a no-no. That leads to reflux, indigestion, cardiac issues. So that's the age-old things that in Marathi we used to call it Shatapauli. Walk for 100 steps before you lie down makes sense today. At least watch TV with your wife, if not your girlfriend.
I recommend 3 hours gap between dinner and going to sleep, because the stomach should be empty when the person goes to bed.
Absolutely.
The heartburns and the chest pain, reflexes of it is manifesting as cardiac chest pain, can be avoided.
I guess that's the biggest challenge for everybody who works in Bombay and travels those distances, that gap. But nevertheless, I think at least we have the ideal formula and we should try to see what best we can do. Dr. Roy, a specific question is, does long gap between meals and fasting increase acidity?
This is a red rag to the bull, Money. I think this is the fad of the Dikshit diet and intermittent fasting. So it does work for some people. Sure, I've seen many people who actually do lose weight without problems, but I've seen a huge rise in the amount of people who've been consulting me in the last 6 months, primarily with constipation, bloating, dyspepsia, stomach pain. And when you go in very carefully into the history, they're actually doing intermittent fasting. And what happens here is that your water intake is inadequate. You're on long periods when you are an empty stomach, that can cause acidity, heartburn, indigestion, and the constipation also. There are also another thing is people are consuming all kinds of Ayurvedic herbal concoctions recommended by all and sundry. You know, every neighbor has some wonderful new concoction that gives you the $1 million immunity. Even the Pfizer and AstraZeneca vaccines don't come close. But this, you know, herbal concoctions can cause a lot of problems. People can get long-term issues also with these, and please be careful. Do everything in moderation. Whether it is alcohol or everything else in life should be in moderation. That is the bottom line. Please be careful of this hand-me-down remedies that people keep trying.
Can I add a comment on that about these Ayurvedic concoctions? I have had 3 acquaintances of mine who have gone on to renal failure and dialysis because of Ayurvedic medicine being taken for treating diabetes. That too, the person took the medicine from his friend who was taking the medicine for his diabetes. And about the intermittent fasting is one of the treatments for the metabolic syndrome which I mentioned. It should be done properly under guidance. It will work.
Absolutely. So therefore, Roy, would you suggest some home remedies if we're looking at handling acidity and such issues?
Yeah, if you have acidity, then a glass of cold milk makes a lot of sense. Using haldi, that asafoetida with milk, also is good for people with recurrent allergies, throat symptoms. You can have a small amount of dried ginger also being taken, but in small quantities, not very large quantities, because those will cause problem for people. And these things often work for people that I've seen.
A common question to both the distinguished doctors. Today, we see a lot of sedentary lifestyle among people, working from home, working a lot on the computers, using the internet, and therefore the activity levels has gone down. What would you recommend as suggestions to take care of one's health in this situation? Either of you can take on. Roy, would you like to begin?
Yeah, I think it's $1 million question, Money. I think in your house and mine, I think we this you will see this, that kids are more on social media rather than physical activity, and that's the way, unfortunately, society is going. And in times to come, it is even the psychomotor, your interpersonal relations, your intersocial relations, your own physical health, your mental health. We see attention span in young children has gone down because they're all the time, immediate gratification is the name of the game. So I think it's $1 million question how to get them off it, but I think very, very important we do something about this.
Dr. Viswanathan?
If you're confined to the house and you're not able to go out for exercise, there are very simple ways. Walk within the house. If you got a step counter, walk 5,000 steps within the house. It may not be continuous, it might be in 3 sessions. Second, you can do push ups 10 to 15 times in the morning, 10 to 15 times in the evening. Or if you are feeling very tired, possibly you can sit on a chair and do like exercises. If you go on to the YouTube and search for exercises for seniors, you got beautiful exercises and which can be done within the confines of the house. Only it's a question of motivation. You require motivation to get it done. And if you remember that if you're going to be physically fit, as you age, your muscles have to be strong, and for which these exercises are very important. No medicines can replace the exercises and the strength which is given by these exercises. So just remember, doctors can treat only diseases. Doctors cannot infuse health.
Okay, I think that's a very important point, and I hope everybody has noted that we are responsible for taking care of our good health. God forbid, if still we are not able to manage that, then of course, distinguished doctors like the experts out here and many others would be able to help us. Roy, there's another question pertinent to the stomach and digestion. There are lots of debates about the use of brown sugar versus white sugar, and you know which brown sugar I'm talking about. So would you like to comment on that?
Yeah, Nani. So definitely the process of refinement of the sugar from brown sugar to white sugar takes away some nutrients from the sugar. And we definitely believe that exposure to chemicals and is not a happy situation. Having said that, brown sugar is still calories. So it doesn't mean that brown sugar is a superfood and white sugar is bad. Both are bad, one less than the other. Money, you'll have to excuse me now. I have another commitment at 5:15.
You
So
mentioned, yeah.
I really am grateful to you for this opportunity to spend time with you today, and great to be with you guys. Thank you, and Dr. Viswanathan, good evening to you.
Bye, bye, Roy.
Thank you so much. I know there's a medical emergency, so we'll catch up with you some other time. Thank you once again.
Thank you. Thanks very much.
We continue our discussions with Dr. Viswanathan. And sir, one of the first things that continued there is a lot of people feel in the treatment of cholesterol and diabetes, honey is very useful. Your observations and experience, sir.
Honey is another calorie source. If it can be used as a substitute for other calories, it could be okay. But honey by itself does not confer any treatment of cholesterol. If you are using honey, the caloric intake goes down, possibly the triglyceride formation goes down, and possibly your triglyceride values might come down. But direct effect on cholesterol is very muted. And honey, if it is purchased from a local source, it has got some beneficial effect because it gives certain amount of immunity. But if honey, if it's coming from Australia, it is of no use to you because it is from the pollens of flowers from Australia. They may not have any relevance to you. On the contrary, there have been instances where honey taken from sources which are far away from your place of residence have induced allergic reactions. So it's better to buy honey which is locally manufactured. And that might confer immunity but may not have much effect on cholesterol. There have been Ayurvedic advices that taking honey at morning, evening, various advices there, but we have not seen any effect on cholesterol per se. Triglyceride might come down.
Okay. We have with us Indrapal Singh ji. He's a very senior industry veteran with the Godrej Group and a former past president of Bombay Management Association. Over to you, Indrapal ji.
I have two questions. One is the role of garlic in reducing cholesterol, and physical exercise versus yoga. Because these days we are all stuck at home and going out for walks, and many of us don't have the treadmills. So can yoga substitute for regular yoga, half an hour, 40 minutes or so? Can it substitute for that much walking in the open?
First question
Particularly for
first.
senior citizens
Yeah.
of our age.
About garlic. Garlic has been touted in a big way in the traditional medicines treatment in India. But the modern medicine guys subjected garlic to an investigation, and they did not find substantial change to recommend garlic as a method of treatment. But garlic is accepted as a treatment among the traditional Ayurvedic physicians. In modern medicine, there may not be a significant role for it. But there is one thing we can say, just as apple a day keeps the doctor away, garlic a day keeps everyone away. Because of the
That's a good one.
second, about exercise, yoga.
Ah.
Yoga is a method of exercise which is supposed to increase your core muscles into the spine, the muscles which are supporting you, which are muscles which are making you stand upright, and also yoga has an effect on the internal autonomic neurological system, those which control your heart rate, your blood pressure, your breathing. These are very good as far as these parameters are concerned. But to increase your cardiorespiratory fitness, you require aerobic exercises, which will form walking or anything which makes you move your muscles freely. So if you do the exercise which I mentioned, you go onto the YouTube and you'll find that these exercises were important. I would feel that both complement each other. Yoga to increase your core muscle strength, and the cardiorespiratory exercises which will increase your cardiorespiratory muscle strength to increase your capacity of the heart and the lungs to help you to function normally. These will be useful. Complement both with each other.
Thank you, doctor. Thank you.
All right. The next question is as follows. There are so many opinions about the ideal number of hours of sleep. Would you like to share your views based on your experiences?
Yeah. Sleep is something I recently read about the sleep because there was a webinar in Jaslok Hospital about sleep.
Okay.
But the conclusion was it is not the quantum of sleep, it's the quality of sleep which is important. And each is highly individual. If the person can sleep for 6 hours and wake up fresh and not be tired throughout the day, that is the ideal quantum for him. If a person might be in bed for 8 or 9 hours and still wake up in the morning tired and groggy, that 9 hours, the quality of sleep is bad. There might be conditions in which the person is in bed, but the quality of sleep is not good. There is something called REM sleep, which is the deepest form of sleep in which during which you have dreams and everything. If that sleep quality does not achieved in the body, the person feels groggy the next day. So you cannot say that 8 hours or 6 hours or 7 hours, but generally between 6 and 7 is the bare minimum for a person. Anything beyond 8, they have calculated that it increases the incidence of heart diseases. Everything which is in moderation, even sleep in moderation is good, but if it is in excess, it's going to be harmful. So you find out what is the quantity which is good for you and take that.
And here, I guess we are talking about the total amount of sleep during the day, or we are talking about night sleep only when you mentioned 8 hours?
Sleep is best at night because no amount of sleep during daytime which will compensate for sleep at night. And whatever you have sleep in the daytime may not be added on to the sleep at night. The quality of because the body requires a chemical melatonin. Melatonin starts getting secreted in the body, which is activated by the pineal gland, which is sitting at the bottom of the brain, above the medulla oblongata, and that melatonin stimulates the sleep production. Starts at 6:30, peaks releases at 10:30 at night. If you are able to utilize the melatonin properly and sleep at night, There is nothing to beat the sleep which can be coming at night, but a daytime sleep is only an icing on the cake. It is not mandatory.
This question assumes significance because today we notice a lot of young individuals and the younger generation tend to sleep late and wake up late. One. Second is in 7 by 24 shifts that we see in so many organizations like IT and call centers, the sleep pattern is completely reversed. What have been your observations about interacting with such patients, if any?
These people are subject to physiological stress. They are subjected to internal and mental stress. The body cycle is disrupted. So they are not able to maintain a proper sleep rhythm. The proper sleep rhythm is not maintained, all physiology becomes abnormal. So there has to be some way in which the person is able to get back to normal sleep. But they have found out if the person's sleep pattern is significantly disrupted, he becomes a victim of many lifestyle disorders and hypertension and diabetes in the long run. So it's preferable that if a person maintains, this is called a sleep hygiene. Sleep hygiene involves sleeping at the proper time, getting up the usual time. If this is not happening, the person might be subjected to illnesses or lifestyle diseases in the long run.
Okay. Another question from the audience is there any difference between the two words, stroke and paralysis? I think these are used very casually if you would give the correct opinion about them.
Okay. Both are consequences of decrease in blood supply to the brain. And this usually is because of some cholesterol accumulation taking place inside the coronary, so the brain arteries or called the carotid arteries, especially the internal carotid artery, which goes into the deep structures of the brain. When you say stroke, stroke could involve various areas. Stroke could involve only the speech area. Suddenly, the person might lose capability to speak. The stroke might involve only the eye. The person might lose vision in one eye. The stroke could involve only one limb. Then it becomes a paralysis. Commonly, when paralysis means the person is not able to move his limbs, whereas stroke could involve any area. There's something called Broca speech area sitting in the below the temporal zone. If that area is involved in stroke, the person loses capacity to speak. There could be involvement of specific areas which might lead to specific loss of function. Whereas when we say paralysis, it is a consequence of stroke involving the internal memory, internal median artery, which is responsible for decreasing the blood supply to that portion of the brain, which is leading to a loss of function in those areas. So stroke is the original reason, paralysis is the consequence.
Okay. Of late, we come across a lot of wearable devices connected to the phone, smartwatches, etc., which help us monitor and track several parameters. What is your opinion, doctor? How reliable are these?
See, that depends upon the personality of the individual. There might be people who use these things, but they become anxious because they're not able to meet the goals. If that be the situation, it's better to avoid them. Whereas if you are using those devices to monitor your walking exercise duration, your heart rate during exercise, your ECG during exercise, and you are able to fine tune your function with along with these reports, possibly it is beneficial. But you should also be aware there could be always certain amount of errors in these devices which might give wrong readings. You should not become perplexed by them. You should not become terribly disturbed by them. If you are able to accept these parameters which are coming to you in the form of electronic reports, you should be able to take them with a certain amount of pinch of salt. But if you're going to become paranoid and tense about it, better not use them.
So they
But
could
there is
be,
one more thing. All
please.
those reports go on to the central server. You are being monitored. You never know how this data will be used. They might be selling the data to some healthcare industry, to some pharma industry, and you do not know how it will be utilized.
I understand that word of caution. And as you rightly said, these could be good indicators. They may not be substitutes for the visit to the doctor who could complete these entire parameter testing in a more professional manner.
There is one wearable device which we use as a medical investigation called ambulatory blood pressure monitoring. 24 hours we monitor the blood pressure. The advantage of this investigation is we are able to know the blood pressure even during sleep. And we have noticed that if the normally the blood pressure is supposed to decrease by 20% during sleep, if it doesn't happen, it is a forewarning of significant diseases like stroke and heart attack in future. And there have been some patients who not only do not have a decrease, they have a reverse dip. The blood pressure increases during sleep. There are an extremely heightened chance of developing cardiac diseases. So these wearable devices which we use can be useful in diagnosing diseases in advance. But these are to be used in medical consultation. You cannot use it by them yourself.
Doctor, you had mentioned in your presentation about the fact that some of these heart diseases, cholesterol, etc., there is the important factor called hereditary. Could you throw a little more light on this, please?
Ultimately, our bodily functions are driven by the DNA of our cells. The DNA we acquire from our parents in the form of 23 DNA from one person, from one parent, 23 from the other. And these have a total control of our bodily functions. If a person has got a, like for example, I mentioned familial hypercholesterolemia, where the genes acquired from our parents produce excess cholesterol, which is far in excess of the normal mild cholesterol that we find in people above the age of 40. It manifests itself at the age of 15 and 18, and they have a big, the incidence of developing cardiac diseases by the age of 30. So these cardiac diseases can be accelerated by the genes that we inherit. You might have seen many people that there is an increased incidence of heart disease in certain families, that the children do not live beyond the age of 45. This is some genetic abnormality. The other genetic abnormality is something called hypertrophic cardiomyopathy, where the cardiac muscles are abnormally thick. When you do the echocardiography, you find that the interventricular septum or the wall between the right ventricle and left ventricle is thickened almost 2 times normal. These people have an increased incidence of sudden death. So these are all incidences which are controlled genetically, and the genetic predisposition produces disease and death in an unexpected fashion. So these have to be examined, especially if a person were to take up some competitive sports. These have to be examined and cleared before going on to the competitive sports, because these form the cause of sudden death in sporting events.
Okay. Another question. What are the pros and cons of a stress test vis-a-vis a 2D echo? And as a doctor, when would you recommend these? Could you throw some light, sir?
These are two aspects of investigating the cardiac 2D echo tells you about the structure, and stress test tells you about the function. 2D echo tells you what is the condition of the heart valves, what is the condition of the cavities of the left ventricle, right auricle, left auricle, and whether they are normal in size or abnormal in size, whether they are contracting normally, whether there is any thickening of the muscle or thinning of the muscle. Whereas stress test shows you the response to exercise. Suppose while doing exercise there are ECG changes, we interpret that there is a decrease in blood supply. Or if there are too many complex irregular beats, that means the heart is becoming agitated, and this could lead to a cardiac arrest. So they complement each other. Suppose somebody has got a heart attack. By doing a 2D echo, I know how much of the muscle is damaged, how much is functioning normally, and how much has recovered from the initial heart attack. And same person, if you are subject to stress, if I find he is able to walk for more than 10 minutes without any symptom, I know despite the heart attack, his heart has recovered well, he can go back to normal activity. Or if there is any abnormality, this might be an indication for doing a coronary angiography, and if needed, an angioplasty or a bypass surgery.
Okay, noted. Another question pertains to the treatment of diabetes and cholesterol. We often hear that people who take medication for diabetes for many years, there is a possibility of the reversal. Could you please throw some light on this?
Reversal in what means reversal of?
I mean to say that they say that the scores might come down and you could stop the medication. So you're cured of your diabetes.
You can be cured of diabetes only if you change your lifestyle, the food is properly taken, and there are certain interventions like intermittent fasting which can reverse your diabetes. But generally, diabetes is a lifestyle disease, and if you take diabetes medicine for a long time, it may not be able to cure you, but at least it will reduce the chance of developing complications of diabetes. There is no way we can assure that the person, if he takes a diabetic medicine for a long period of time, that he'll be cured of diabetes. You need diabetes medicines almost lifelong, except in certain intervention with drastic reduction in body weight, or if the person undergoes what is called the obesity surgery or a bariatric surgery, when diabetes can disappear. Another condition where diabetes disappears is when we take the Ayurvedic medicine, but the kidney also disappears with that.
You did mention this very
Yeah,
interesting,
yeah,
unfortunate case study
yes,
before. Yeah. We have with us someone who's also a very, very passionate yoga master. And he's been part of several of our BMA programs also. Shrikant, over to you. You had an observation and a question. Go ahead, Shrikant.
No, I think I sorry, I joined a little late, but I picked up whatever Dr. Patankar and Mr. Viswanathan has said rightly, that yes, this is uh, you have to be in moderation is number one, and the second point that I picked up was like take care of your health. That is your responsibility. And if any complications are there, then you take professional advice. I think that's the good part of it. Yeah.
Sure. Thank you.
Yes.
Thank you, Shrikant.
Thanks.
Dr. Viswanathan, the next question is, how do I decide whether my BP is in control or not? Now, I know that's not a great question because you don't decide, the doctor decides. But what is a good optimal score that one needs to stop taking medicine?
everyone thinks of only stopping the medicine. Nobody thinks of stopping the disease.
Absolutely.
Your
Absolutely.
blood pressure should be 130 by 80, period. No discussion on that. It could be 120 by 80, but it cannot be 140 by 90. It should be 130 by 80. And whatever method you adopt to control this, reducing salt, improving exercise, taking medicines, all of them are complementary. The medicine dosage might decrease over a period of time if you have a healthy lifestyle. But whether you'll be able to stop the medicine, only time alone can say. Most of the time, we have the newer medication that we have got, the sartans which are coming to the field about 5, 6 years back. They are able to reset your internal mechanism that over a period of time there might be a need for reducing the medicine. Whereas the previous generation of blood pressure medicine, they would only control the blood pressure, will not do anything to the internal mechanism. Whereas the newer generation of medicines are also able to reset your internal blood pressure producing systems and mechanisms. And over a period of time, there are chances that the blood pressure medicine might be gradually reduced. But that is not should not be the primary concern. Primary concern should be to control the blood pressure and prevent formation of diseases.
All right. More specific one, which came in later. I am 62 years old and I'm reading the question. My BP without medicines is 135 by 85. Is that a good time to stop medicines? What is your view?
When you stop the medicines, your blood pressure will automatically go up over a period of time. It has to be monitored. It all depends upon what all medicines you're taking. If you're taking 3 medicines, possibly a doctor might try to reduce it to 2 medicines and see the response. He might ask you to do what is called a home monitoring of blood pressure. Nowadays, good blood pressure monitoring machines are available which can monitor your blood pressure very well. If you are able to do that very regularly on a regular basis, possibly there might be a chance for modulating the blood pressure medicine, but I would not say that there is a chance of stopping the medicine totally. There's a gradual process that the doctor has to decide. Please do not stop your medicine on your own because there could be rebound hypertension, which could be extremely harmful. It could even lead to a stroke.
Right. As you said somewhere before, self-medication and deciding about medicines oneself is not the best thing to do in any circumstance. That's a very, very valid point. All right. The next question is, okay, there are some questions related specifically to medicine, so I'm not really getting into that. I'd like you to also just reiterate how much of exercise is sufficient exercise, because we also hear of situations where an overdose of exercise could lead to different kinds of problems. Would you like to prescribe an optimum amount of exercise?
Think of exercise as medicine. Every medicine has a strength, there is the duration, there is frequency. So similarly, strength of exercise. Strength of exercise should be such that your heart rate goes up to about 110 per minute on maximum exercise if you are below 60, and 100 if it is below if you are above 60. And frequency, at least 5 times a week it should be done. What is the duration? Duration is at least 25 to 45 minutes a day. If these are maintained, then possibly you'll get benefit. If any exercise is less in this quantum, the benefits are reduced. Exercise duration less than 25 minutes doesn't benefit you. If the heart rate doesn't go up, if you are thinking that going to a market and buying vegetable is exercise, that is fooling yourself. It doesn't help. The heart rate has to go up, the respiratory rate has to go up, and your body metabolism has to go up. If these things do not happen, exercise is just a token just to keep your wife mouth shut. That doesn't help you.
Okay, I understand the perspective that you are coming from. Doctor, the other question that's coming up is we hear a lot of cases these days about juvenile diabetes. You did mention about a lot of younger people getting into diabetes and cholesterol issues. Could you throw some light on how can one tackle this? How does one identify some such symptoms if this happens?
Juvenile diabetes and premature type 2 diabetes are entirely different. Juvenile diabetes is a condition in which the pancreas just doesn't produce any insulin, and the person develops diabetes. The person just wastes away. And Banting, who invented insulin a long time in the 50s, we studied the patients who had juvenile diabetes. He could reverse the process and he could cure them of all the debilitating diseases. Whereas the early onset diabetes, which is found in families, they are due to abnormal resistance to the function of insulin. Initially, the pancreas keeps on secreting insulin more and more to control the blood sugar, but it fails after some time. Then subsequently the person requires insulin. So these are two different aspects. Juvenile diabetes is usually genetically determined, strongly found. Possibly another cause is some infection destroying the insulin secreting capacity of the pancreas. Whereas early onset type 2 diabetes is a metabolic disorder. It could be acquired or it could be genetic. Both can happen. Whereas in juvenile diabetes, usually genetic. Juvenile diabetes definitely requires insulin as a part of treatment, whereas early onset type 2 diabetes can initially be treated with tablets.
Essentially, these are two different concepts, but yet both of them do affect the younger generation at large,
Yeah.
is what you were suggesting. All right, I think that's the kind of no more questions at this point in time. Thank you so much, Dr. Viswanathan, for so patiently answering so many of the questions. Dr. Roy has conveyed his apologies that he had to exit in a hurry because there was some medical emergency. He would have loved to be here with us. So on that note, I'd like to thank everyone who was present here this evening. I'm confident that all the wisdom that was shared here would be immensely beneficial to us, and we would keep some of this in our minds so that we take care of ourselves in time to come. Let's put on our cameras to have a group photograph with Dr. Viswanathan, which will serve as a memory of the times that we spent this evening trying to learn a little more about how to keep ourselves healthy. Please put on your videos and give us about 2 minutes to cover the two screens which are here. We had about 65 people present during the entire discussion. Some of them have since left, but doesn't matter. We have our efficient staff from the BMA Secretariat, Lakshmi, Supriya, Oindrila, who will do the honors. Please have some digital patience so that we can capture all of us here who will be remembering this wonderful wisdom that we acquired from our expert medical professionals. Cameras on, please.
Professor Mani, I've attended many Zoom talks, but this is the first time I'm going for a group photo of the event.
All right, so I'm glad that it's going to be your first experience, and this will come back to you as a memento so that you can also remember having spent this time with us. All right, everybody, I can still see some people without their cameras on. Please quickly do that so that we don't have only your name. We can also have the pleasure of seeing you smiling. Mukh darshan dijiye humko. All right, team, go ahead and let me know once we complete. All right, we've got the thumbs up signal from the team, and I'd now like to request our honorary treasurer of the Bombay Management Association, who incidentally is also the president, Human Resources and Legal for the Raymond's Group, Mr. K. Narayan, to please propose the vote of thanks on behalf of the Bombay Management Association. Over to you, Mr. Narayan.
Thank you, Professor. No, you call this session Zen and maintenance. It sounded very scary because both the heart and the organs, when you say it is to be maintained, it looked like maintaining a vehicle. But after listening to the two eminent doctors, it felt like it's so simple. True to their specializations, I know Dr. Viswanathan for many years, happens to be also related. It was a real pleasure to listen to how simple it is to maintain the heart and maintain the diet and be comfortable with yourself, because every time you hear of a heart attack or you hear of some of these procedures which are so complex, whether it is the angiography or the angioplasty or the bypass, and every time you hear of stories of how people who are near dead come back to life, it felt so comfortable to be with a cardiologist of this stature and eminence. And thanks for getting him on to our forum and making everybody so comfortable to deal with some of these challenges. Also, when I listened to the other doctor, it felt like some of these issues, which is to do with laparoscopy, are so easy to deal with, and piles and some of the problems that one deals with every day are to do with one's self-discipline and maintaining oneself properly. So I must thank all the participants for being here, and also thanks to you for moderating it so well. And thanks to all our office bearers who are on this show today. And it was a Friday evening well spent, thinking about our own health and future. So thanks again to BMA and to all of you for the special evening today.
Thank you so much, Mr. Narayan. And I appreciate what you said, that getting doctors like these to spend their very valuable time with us just reconfirms our faith in humanity. As they rightly say, that very often when you think that everything has come to a near end, it is that good old doctor who really makes the difference to our lives and brings it that smile and cheer to ensure that every one of us is healthy. Thank you, Dr. Patankar in absentia, and Dr. Viswanathan for the wonderful sharing of knowledge. And I hope people will go back home a little wiser this evening. In the meantime, as we move from lockdown to unlock, please continue to remain safe. I remember reading an article of Dr. Viswanathan somewhere on Facebook. He's a very regular contributor. And he said that only lockdown has gone away, not corona, but still be careful. I just remembered that as I was sharing this sentiment. So stay safe, stay blessed, and have a great weekend. Thank you very much.
Thank you, Professor Mani. Thanks everybody for attending this session. Thank you so much.